Hi everyone, today I am back with another roleplay and a warm-up section. Many of the OET aspirants may be stuck on the journey to pass OET due to the outbreak of COVID-19, and many may be worried about not knowing what to do. Continue your practice and be prepared for the test. Use the time wisely. Mr. Alex and Miss Nancy will join with us to perform the role of candidate and the invigilator. If you feel good about the things we are sharing, please don't forget to like, share and subscribe. Write your comments and suggestions below. Hi, good morning. My name is Nancy. I am the invigilator here for your OET exam on the 12th of August 2020.
Good morning.
May I know your name, please?
My full name is Alex Jones. You can call me Alex.
Okay, Mr. Alex, can I have your passport, please?
Sure, here it is.
Please tell me your candidate number.
It is 2586441.
Let us move to the warm-up section.
Okay.
Please introduce yourself.
My name is Alex Jones. I come from Idukki. I am a nurse by profession and I have 2-year experience in the cardiac ward from a reputed hospital in Bangalore. I completed my nursing degree from Kerala University.
Tell me about your typical working day in the hospital.
Well, if it's a morning shift, it starts at 7:30 a.m. and I start my duty with inventory checking. After that, I find my allocated patient and take handover from the previously allocated nurse. During that time itself, I try to make an interpersonal relationship with the patient by talking with them and by introducing myself. Then I provide food, medicines for my patients and assist them for their needs. I attend doctors' rounds and do as per their notes. When my shift become over, I give handover to the next shift nurse and leave the ward.
As a nurse, what do you think is the most important thing for a person?
In my opinion, the most important thing for a person is their health. I see a lot of patients daily, and all of them are fighting for their health. Many of them are disappointed because they don't get health no matter how much they are fighting. Health is very important as well as it needs to be maintained.
How would you work for your society in a pandemic situation?
As a nurse, I believe it my duty to work for my society in a pandemic situation. I will try as I can to treat the patients and help them to overcome the disease. Moreover, at the same time, I try to maintain the health of myself and my fellow healthcare workers. It is also my duty to provide health education, advice and guidance to control the outbreak.
What is the unforgettable day or moment in your clinical experience? Describe it.
I have had a lot of experience and one of them happened a week after I joined in the hospital. There was a teenage patient in my ward and her father came to visit her during the visiting hours. During that time, he had a cardiac arrest and fell down in the ward. No one expected it all. Quickly, we started the initial steps of Code Blue and announced it. Soon the Code Blue team arrived and he was provided CPR. Later I found out that he was admitted to the intensive care unit. That was very strange and an unforgettable incident in my experience.
Well, finally, what is the most satisfying part of your job?
Providing care for patients is the most satisfying part of my job. Moreover, when I hear that they had a good experience with our service is really satisfying.
Alright, that's the end of your warm-up section. Now, let us go to the roleplay. Here is your roleplay card. Your 3 minutes preparation time starts now. Your preparation time is up. I will stop you when the 5 minutes of roleplay ends. You can start now.
My name is Alex, I am one of the registered nurses working in the hospital emergency department. please tell me your name?
My name is Nancy.
Okay, Ms. Nancy, how can I help you?
I came here to get any medicines for my migraine. I am having it from yesterday and it's terrible.
I am sorry to hear that. Don't worry, it will be alright soon. Have you ever consulted a doctor before?
No, it is the first time for migraine. Since yesterday I have been experiencing headache, and I took some over-the-counter painkillers, but that is not working anymore. It's been worsening. I have checked on some websites about the reasons for my headache and I found that my symptoms are consistent with migraine. So I decided to come to the hospital.
That is a good decision which you have made. You will get the proper treatment from here. I would like to know some more details regarding your condition for a proper understanding. May I ask a few questions you?
Definitely, please go ahead.
Can you tell me a little more about the pain you have?
It is mainly on my left side of head, and I can say that it is a pounding headache.
How would you describe the intensity of your headache? You can rate on a scale when 1 is the least pain and 10 is the worst pain you have ever experienced.
If it's so, I rate it 7.
I can understand that you are having severe pain. Could you please tell me if any other symptoms you have along with headache?
Yes, I have. The pain is accompanied by nausea and vomiting. Moreover, I have noticed that increased sensitivity to light and sound.
Thank you for answering my questions. It would be really helpful. Now, you can take rest here and the doctor will see you within 30 minutes.
What you are saying? Should I need to wait for another 30 minutes? It's look like you don't understand my situation.
I know what you are passing through, and it might be difficult for you to cope with. However, we need to wait for the doctor as he is taking care of an emergency patient. Let the doctor come and consult you for the proper handling of your headache.
What do you mean by that? I am having an uncontrollable headache. Still, I answered for all your questions. Again, you make me wait here.
I can see that you are frustrated, Ms. Nancy. I have collected and recorded your history for an initial assessment. It should be really beneficial for the doctor. Please be calm and take rest until the doctor comes. I can assure you that he will consult you within the next 30 minutes and will diagnose your condition.
I don't need it. Already I have confirmed from the online websites that it is migraine. What I need are some medicines to get relief from this terrible pain. Could you please provide me that?
I am sorry to tell you that I am not able to provide any medicine without a consultant's prescription. The doctor is the only person who can make a proper diagnosis and prescribe medicines. Moreover, you were told that the migraine was self-diagnosed. There is a lot of risks are associated with self-diagnosis and self-treatment. So, those are better to avoid and always seek medical advice.
What risks you are talking about?
I will explain to you about that. Online websites which provide health information might not always be accurate. There are greater chances existing for misleading as those are not from reliable sources. Misdiagnosis can result in improper health care, including wrong treatments and lack of care for serious conditions. Did you get what I said?
But all my symptoms are the same with migraine.
Without a proper checkup, we cannot say that your symptoms are due to a particular disease. The doctor will do a detailed checkup and perform investigations if necessary to find out the exact reason. For proper management, these are very necessary.
Ah. Okay. I will wait to see the doctor. There is no other way.
Well, I am happy to hear that. I hope you understood the importance of getting appropriate medical consultation.
Yes, I get it.
That's great, Ms. Nancy. Take a rest here, the doctor will come soon. Meanwhile, if you have any requirements, just let me know.
Okay, thank you. That's the end of the roleplay. We are demonstrating only one of the ways to manage that situation. Share it with your friends. Thank you for watching. We will back with another video. Bye, see you soon.